Okay, I know I'm not the only one who gets nervous about going to the dentist, and medical procedures can be scary and intense. They can even be traumatizing. In one of my recent group calls with the Therapy in a Nutshell members, I met Kathy, and we had a follow-up call in which she described what it was like to have her heart restarted.
Totally terrifying, just totally terrifying.
What Kathy described as medical trauma, which is psychological trauma that stems from a medical incident. This can happen after an emergency or accident, or planned procedures like surgeries or routine treatments. It might come with a new diagnosis like cancer, or from dealing with dismissive or harmful medical professionals. Medical trauma is surprisingly common, so in this video we'll explore what causes it, how your body can become your trigger, and how you can heal, and some things you can do to prevent it for yourself and your kids.
I had congestive heart failure when I was in my 30s, and they couldn't figure out why it happened. Went through a series of treatments for that for 30 plus years, and then ended up with ICDs because the heart was getting weaker.
What's an ICD? Could you tell me?
Internal cardio defibrillator.
Okay.
So those machines they zap you with, they implanted inside your body, and you get zapped from inside out to get your heart going again. And aren't you lucky because we got your heart going, but your heart stopped, you got zapped, sometimes to the point of knocking you out. And it's not a pretty picture. So not pleasant, but life. And I had always said that I wouldn't make it to 60. And so 58-ish days before that, I had a heart transplant. And you've got that mom voice saying, okay, buck up, you can do this, just grit your way through it, just push, you're okay, just do it. And you keep doing it. And I realize now that I live in hypervigilance and overwhelm most of my life.
Medical emergencies are often painful, frightening, or even life-threatening experiences, so it makes sense that they are stressful. But there are some critical aspects that make them more likely to lead to PTSD. These include physical pain or shock. So when your body's in pain, or it's overwhelmed, or it's shutting down, it can't process what's happening very well. And you may dissociate or have a hard time working through these big feelings, and that can get stored as trauma. For Kathy, it felt like she was free falling in a black hole. The second one is loss of control. You often can't help yourself in emergency situations like car accidents or heart attacks or surgeries, or even during recovery. ICU patients are often restrained or on medication that leaves them feeling disoriented or confused or powerless. When you don't know what's happening and you're dependent on others to save you, that helplessness can be traumatic. This is why children are especially vulnerable to medical trauma. They don't understand what's going on, and they're often restrained. When a medical condition takes away physical capabilities, that loss of control can put someone into a grieving process. Kathy said,
I lost a lot of my independence with the defibrillators because you're not allowed to drive if you had an incident within a month. And because I was getting shocked every month almost, I had to depend on someone else to pick me up and take me to work. And I'm not someone that asks for help. I hate that.
And another big contributing factor to medical trauma is betrayal of trust. When people who are supposed to help you add to your pain, this can fuel medical PTSD. So, for example, like misdiagnoses, malpractice, lack of pain management, botched surgeries, or unnecessary procedures. Anything that adds more to your pain can lead you feeling vulnerable. And this is especially true when you feel betrayed by a medical community that you think you should trust, and then they end up causing more harm.
Right after transplant, you have an echocardiogram done like every month for like 6 months. And there was this young technician, and he kept pressing, and I have a scar from the transplant, and he kept pressing and pressing, and I said, that hurts. And he'd say, that's okay. And he just kept doing that over and over and over. And finally I said, it's not okay, it hurts. And instead of stopping again, he said, well, I'm almost finished. And he didn't have to hurt me to do it. Nobody else hurt me to do that.
Right.
But to have someone that's doing a medical procedure and they don't listen and you tell them this hurts and they won't stop and they won't change what they're doing. Yeah, that's abusive. That's not traumatic. That's abusive.
Kathy went on to share that because of the technician that was dismissive of her pain, she had stronger fear reactions to other procedures. And I've also heard so many stories of doctors dismissing pain as just being anxiety. So this medical mistreatment can fuel trauma and PTSD. So physical pain and shock, loss of control, and betrayal of trust can all contribute to developing medical trauma. Now, medical trauma isn't its own diagnosis. It fits under the category of PTSD. And not everyone develops PTSD after an intense medical event, but it is pretty common to have acute stress disorder. So this is where you feel scared, anxious, or maybe you have trouble sleeping during the first few weeks after a stressful situation. But with some time, the brain and body often process that stress, and we heal and we bounce back. But if we get emotionally stuck and we can't work through those feelings, short-term reactions might develop into PTSD. Now, the definition of PTSD is that you have 4 key symptoms that have lasted at least 4 weeks after a threatening event, and they cause severe distress or disruption to your life. Number 1 is avoiding reminders of the event, like specific people or places. You might avoid making follow-up appointments, or avoid driving by the hospital, or avoid checking your heart rate, or noticing what's going on in your body, a form of dissociation. Number 2 is re-experiencing. This can show up as distressing memories or nightmares where you feel like you're reliving this trauma. You might have like physical sensations like pain somewhere or heart palpitations, and this can fuel a cycle of chronic pain or panic attacks. Number 3 is changes to your mood. So this could be feeling more sad, irritable, angry, depressed, or difficulty feeling positive emotions. You might be stuck feeling kind of numb or zoned out. With medical PTSD, you might have health anxiety, which is where you constantly worry about your health and physical symptoms. And then number 4 is reactivity and hyperarousal. So this is where you feel jumpy or on edge. You might have difficulty sleeping, or you might feel more anxious or irritable. Kristen Mullane is a medical trauma expert, so I interviewed her on my Therapy in a Nutshell podcast channel, and it was interesting to hear how routine procedures can trigger PTSD from past medical trauma.
Medical trauma can look and present at different levels of care.
Right.
A primary care office visit can bring back memories of an ICU stay. There's enough similarity in the environment that people can be reactive in that space, and then because the reactivity is there and they're walking to the doctor's visit with like maybe white coat syndrome where their blood pressure rises, like kind of a trauma symptom, right? Like they're walking in hypervigilant already. There's more of a risk that they're going to be re-traumatized in that space. So I've definitely had patients who, like they had birth trauma in their past, but they didn't really have PTSD symptoms until a nasal endoscopy, which is a routine procedure years later. That's when the PTSD symptoms started to present, because that's when they had enough go on medically that they started to think there's something wrong with me. I'm different. I'm bad or wrong. And so in terms of like the belief impacts, we do see things around power and control, also esteem for people and safety and trust, right? Like, it's just, we see a lot of different ways that a person's whole self becomes impacted.
Now, one of the really unique aspects of medical PTSD is called enduring somatic threat. It's where your body becomes one of your trauma triggers, and it's one you can't escape. So, for example, if someone experienced a heart attack, when they see their scars, or when they feel breathless, or their heart skips a beat, they might get triggered by their own body sensations and re-experience that trauma they felt during their heart attack. Or a woman who loses a baby in childbirth may feel like her womb betrayed her, that her own body let her down. And the grief and the pain that come because of her own belly are something she can't escape. So that's one thing that makes medical trauma especially difficult. After a medical crisis, the brain might keep scanning the body for signs of danger, and that's going to keep that stress response active. And this is different from other forms of PTSD, where the original trauma is a past event or the triggers are something you can avoid. In medical trauma, the body itself remains the trigger, the perceived source of danger. Now, in our original call with the group, Kathy described how a harmless sensation in her body would trigger her fear response.
Before the transplant, I had an internal defibrillator, and there was this feeling that I would get before it would go off. And it's this full body sensation where it's pain rolls from your toes to your head. And that gets triggered from time to time when I feel that. And there's no reason for it to actually be triggered anymore, but it gets triggered and it's scary because, oh dear, what's happening? Am I okay? Are we going down a bad path here? What do I need to do? Do I need to get help? Yeah, just fear.
To cope with the ever-present triggers from the body, people might get stuck in avoidance behaviors like refusing medical checkups or avoiding activities that elevate heart rate or overusing health monitoring devices. The trauma says, I have to constantly check my blood oxygen saturation or something bad could happen. And so this constant activation of the fight or flight response leads to chronic stress, fatigue, and anxiety. And this can be really difficult for the body to return to a state of calm, and it can leave you feeling just kind of anxious and exhausted and overwhelmed all the time, or make it really hard to sleep or function at work. Okay, so you get stuck in this on position. Now, the good news is that when we learn to recognize medical trauma, we can also learn how to heal from it and even how to prevent it. So once you can see that you might have some PTSD, it's probably most helpful to seek professional treatment. And I'll share what I would do if I were Kathy's therapist or if I was someone's therapist who was dealing with medical trauma, so that you can see that there are really a lot of options that can help. And then I'm also going to walk you through a couple of practical things that you can do on your own to help prevent or overcome medical PTSD. Okay, so big picture, treatment for medical PTSD includes talk therapy, body work, or the option of doing gentle exposures or medication. Now, so let's talk about therapy. If I were Kathy's therapist, we would create a safe environment to work through triggers or memories or unhelpful thinking patterns. Trauma can impact your belief about yourself. So for example, you might think, oh, I can't trust my body. So in therapy, we'd explore how to replace those thoughts with something healthier. Like, my body is great at some things and my body feels safe in other areas. And in these areas, I'm coming to accept and explore how my body's working. Group therapy, journaling, even medication can be helpful there. And all of these forms of therapy provide an opportunity to approach painful thoughts and feelings instead of avoiding them. And that's key to decreasing symptoms of PTSD. I think it's really important to understand that PTSD is when we aren't processing because we get overwhelmed and we avoid. And so anything that can help gently and gradually approach our fears and our triggers can help treat PTSD. Okay, and I also think it's really important to recognize that PTSD isn't about the past. It's about how the body is still responding with a fight or flight response in the present moment. It's about those sensations and those nervous system responses that happen right here, right now. To help the body process medical trauma, another really valuable tool is somatic therapy. So somatic therapy is how we work through the trauma that's stored in the body by addressing those sensory memories with gentleness. So we'd probably first start with resourcing skills. These are skills to help you when triggers come up. They can help you soothe yourself and return to your sense of safety. This might include things like breathing techniques, grounding skills, vagus nerve exercises, visualization exercises like visualizing your safe place. And this can also include body-based techniques like massage or acupuncture. If you'd like to learn more about these grounding skills, I have a free course that can teach you how to regulate your nervous system. You can check out the link in the video description if you want to learn more. Okay, so it's also fundamental in somatic therapy to learn how to relate to your feelings and sensations with gentleness and openness. And Kathy gave some good examples of her self-talk during triggers.
When I went to have the echo this year, very nice technician. She was wonderful, very gentle, very kind. And I didn't have that, although that part was waiting to come up and say, they're going to hurt you again. You better, tense up. But I've learned with that just to say, okay, thank you for reminding me that this might hurt, but let's just wait and see. Okay, let's see what's going to happen. Let's give it a chance. And that technique for me in the last 2 months has just been golden. How much that kills the anxiety of that situation.
Now, Kathy's already doing a good job relating to her fear and her sensations with openness and with curiosity and with gentleness. Mindfulness training is a really great way to learn how to do that, to learn to notice and create space for those physical sensations without judging them or panicking. Another thing to think about is often during treatment, medical treatment, people are immobilized. So that means that your body can't complete its natural fight or flight response. And somatic therapy can help you release this trapped survival energy. And one of the ways you do this is by tracking tension. So for example, if Kathy gets like tension in her shoulders when she remembers her surgery, I might say, what happens if you let your shoulders drop? Or can you gently shake out your arms and see how that feels? So you use movement to complete that fight or flight response. Now, as Kathy would talk through her experience, I would help her find actions to take her to finish her fight or flight response. So if, for example, she felt trapped in the hospital, she could make like gentle pushing motions against the wall or simulate escaping. If she felt silenced, she might practice humming or vocalizing to reclaim her voice. So by allowing her body to complete these instinctual movements, her nervous system learns that the danger is over and that she's no longer helpless. So that's one of the ways we might use somatic therapy as a way to treat medical trauma. So in addition to talk therapy and somatic therapy, the third treatment option is exposure therapy. And this can be really helpful. So especially if someone's really avoidant of doctors or hospitals, working with a therapist to gradually face those fears can greatly reduce anxiety and help you regain a sense of safety. And it's important to note, we're not just gonna like throw you in the end here. We're gonna start super slow and gentle. So if someone was like avoiding going to their doctor, they're very afraid of going to a doctor's office, they have panic attacks at their doctor's office, we might start by just looking at pictures of a doctor's office and then noticing your body's response and then practicing soothing and grounding skills. We might imagine, after we did that 10 times over a couple of weeks, we might then imagine going to a doctor's office or look at more pictures or videos of medical situations online. And you just kind of notice your sensations of distress, gently calming your body down, and also creating some willingness around those feelings. It's okay to have feelings. We don't need to force them to go away. We can gently guide our body to calm down. And we just do that over and over again until looking at those pictures or imagining a medical situation doesn't cause so much distress. And then next, maybe we'd go visit a hospital parking lot without going inside, or go sit in a waiting room and practice relaxation techniques. And finally, perhaps we would attend a doctor's appointment and I would support my client at that doctor's appointment as they go through it. Kristen Mullane says she often does teletherapy with a client while they're attending their doctor's appointment. So this is the really slow, gradual, body-focused exposure, and that could help someone like Kathy help her nervous system re-regulate without forcing her to re-experience the trauma too quickly. Now, I think it's really important to work with the brain and body together when healing medical PTSD. So with the help from a therapist and with courage and effort on your part, you also can learn to regulate your distress, you can release stored trauma, and you can regain a sense of safety around medical care. In addition to these treatments, I think it's really just as important to mention how we can prevent medical trauma. And providers and patients both play a role in preventing fears, phobias, and PTSD from developing. Medical providers have a responsibility to help patients feel safe and supported and protected during their experience at the hospital or in an emergency situation. They should take the time to explain treatment and provide options whenever possible. They should provide a soothing environment, and they should learn to recognize the signs of distress in their patients. And then as far as on the patient side of it, patients and parents of children receiving medical care, we have the right to feel safe and heard in medical settings. Your voice and your experiences matter in receiving good health care. I think it's important to feel empowered to shop around for medical professionals who are going to listen to you and involve you in the decisions. And I think it's important as a patient to practice advocating for your needs during medical appointments. And this can help you kind of regain that sense of agency, that sense of power inside of you. Some of the ways you can practice this might look like writing down your questions ahead of time, or practicing your questions before you go to the appointment, or taking someone with you to help you. I'm going to share a link in this video's description of a resource that can help parents and patients and care providers know how to recognize and respond to distress so that medical interactions don't become traumatic. And I just wanted to kind of wrap up with some of Kathy's advice.
I wish I had learned to use my voice earlier. I wish I had learned to trust myself and my intuition, and to know that I know my body better than anybody else. And when you tell me that what I'm telling you isn't true, and I know that it is true, I need to tell you you're wrong.
Yeah.
I don't care what title you have behind your name. I know my body and trust my body, because all of those medical people that told me I couldn't trust my body, I started believing that I couldn't trust my body. And now I'm learning to trust my body again and to speak up for my body. And I would hope I wouldn't let it happen again, that I would be more stand up and say what I need to say at the time.
Yeah.
And I think just learning, trust yourself, which it sounds so easy and it's so hard.
All right, medical PTSD is all too common. There are a lot of people suffering like Kathy was. And even though trauma can feel overwhelming, healing from medical trauma is possible. Your brain and body are wired to process through these experiences and heal. If you have PTSD from medical care, I hope you'll take one small step toward healing today. Whether it's scheduling therapy or journaling about your feelings or seeking a support group. Also, if you're interested in joining our weekly live calls, you can go take a look at our membership at therapyinanutshell.com. And again, if you don't want all the benefits of my membership, you can still get my free course, Grounding Skills for Anxiety, as well as a bunch of other free resources on the website. Okay, as always, thank you for being here and take care. Hi there! If you found anything in this video helpful, I would really appreciate it if you could give it a thumbs up or share it with someone who could benefit from it today.